Now, I want to first discuss a little bit about sexual assault, sexual abuse, and rape, which unfortunately are huge problems in South Africa. The statistics suggest that a woman, child, female child is raped every 26 seconds in South Africa. We have the highest rape statistics in the world. So let's deal with sexual assault or sexual abuse first. So boys and girls, look, you have to take responsibility for yourself, responsibility for your body, okay? Only you can do that. Nobody is allowed to touch you, to do anything to you that you are uncomfortable with. Should that happen, say no, attempt to run away, seek help from a responsible adult, and tell them about what has happened. And hopefully they will then protect you and see that the right thing is done. As regards rape and sexual assault, basically that is sexual intercourse or sexual activity, including touching, oral sex, that one partner has not consented to. Okay? Should this happen to you, it is important to talk about it. It's important to seek help. It's important to speak to an adult who can get a doctor to see you so that you can get the appropriate treatment, including prevention of pregnancy, including treatment for the prevention of STDs, and then obviously to report that to the police so that the offender can be arrested and charged, and so that he cannot do that to someone else. It's important to realize that in these scenarios, you are the victim. You are not responsible for it, and it is not your fault. And subjugating it, not talking about it, leads to long-term mental and psychosocial problems. So I think it's very important that we talk about it, and openly and honestly. And I also think that as friends, if your friend has a problem and he or she comes to you and tells you this is what happened, I think it's important, and it's an individual responsibility to help that friend, encourage them to speak to a responsible adult, and if they are unable to or unwilling to, I would go to the extent that you should then take that to a responsible adult so that that friend can get the necessary help. Okay, so the two biggest issues with sexual intercourse, is teenage pregnancy and sexually transmitted infections. Okay, so teenage pregnancy is a huge problem in South Africa. Statistics estimate that about 16% of females currently pregnant are between the ages of 15 and 19. And at that age, you are still a child. You are still learning who you are, where you fit in. So for you to now be burdened with the responsibility of carrying a pregnancy, delivering a child, and then looking after that child, I think is ridiculous. You do not have the physical, the mental, the emotional, and obviously the financial means to do that. And it's something that's important to consider and to think about. So it's important that we understand the consequences, because a single act, a single sexual encounter can result in a pregnancy. And then you are going to pay for that act, that action for the rest of your life. And it's important to think about that. And that's what growing up, that's what going through puberty, going through being a teenager is about understanding responsibility, is understanding that our actions have consequences. So before we act, we need to know what the consequences are, and we have to accept the consequences and then choose whether we act or not. Okay? So that's a very important thing to learn, in becoming an adult. That's a very important lesson to learn. The other issue with teenage pregnancy is obviously it affects your ability to complete your schooling, to complete a school diploma, and obviously you're then unable to go to university, get a degree, be able to be employed and earn a living. And you also have the burden of having to look after a baby, which is expensive. So it's going to have an impact on you and your financial health for the rest of your life. And that's important to appreciate.